everyone. So today we are here to talk about communicable disease, example COVID-19 and flu education mission in Tharu community. So I would like to first start with acknowledgement. I would like to acknowledge Tharuk people, the traditional custodians of the land on which we meet today. I pay my respects to elders past, present, and emerging, and extend that respect to any Aboriginal and Torres Strait Islander people present. We are committed to ensuring that public health initiatives align with the cultural practices and values of Tharuk community. So the participants of today's meetings are Sumina, me, myself as a head of organization, Supriya as my colleague, and Prudence as a specialist, and Suveksha as an interpreter. So the objective of today's meeting is to develop culturally appropriate strategies for managing communicable diseases such as COVID-19 and the flu within the Tharu community. Identifying challenges in delivering health services that respect cultural safety and promote trust, and to discuss best practices, strategies, and consultation methods to involve the Tharu community effectively. So, good morning, everyone. Thank you for coming today. Today, we are focusing on how we can address communicable diseases, particularly COVID-19 and seasonal flu, in a way that respects and aligns with the values of the Tharu community. I want this conversation to be an open exchange of ideas. Supriya, could you share some of the challenges we have observed so far?
Good morning, Sumina. One of the most persistent challenges is vaccine hesitancy. Some members of the Tharu community are cautious about vaccination due to the past experiences of exclusion and fear of health institutions. Another issue is language barrier, which make it difficult to communicate critical health information effectively. There are also transportation and access issues. People may live far from clinics or be reluctant to visit mainstream healthcare facilities. They are culturally sensitive.
Adding to that, we also see the cultural gathering, which is essential for the community, pose a unique challenge. This event brings people together in large numbers, increasing the risk of spreading diseases. While these gatherings are vital for community cohesion and cultural identity, we need to train carefully, finding ways to reduce health risks without undermining these traditions.
I completely agree, Prudence. This is where cultural safety plays a crucial role. Let's go around and share what cultural safety means to each of you.
Okay, so for me, cultural safety means more than just awareness of traditions. It's about respecting people's and creating space when they feel comfortable accessing services. It involves understanding and acknowledging the trauma that indigenous communities have faced and ensuring the healthcare system do not repeat those mistakes by acting in ways that are inclusive and empowering.
I think cultural safety involves engaging in meaningful partnership with the community. Health services need to be co-designed with elders and leaders so that solutions reflect community values. It's not just about offering treatment, it's about building trust over time so that the community feels ownership over health initiatives.
Yes, trust is key. Many indigenous people have experienced discrimination in the healthcare system, so we need to listen carefully and respond to concern thoughtfully. Providing interpreters like me is one way to ensure that communication is effective and respectful.
Thank you all for those thoughtful responses. Now let's talk about the challenges of maintaining cultural safety in the workplace. Supriya, do you want to start?
Sure, one of the main challenges is that staff often lack the training and time needed to engage deeply with the community. They may not understand cultural practices well enough to avoid miscommunication or even unintentional disrespect. There is also the issue of policy implementation. Policies may promote cultural safety, but if they aren't followed consistently, they become more meaningless.
Although that staff burnout can also be a factor. Well, when healthcare workers are overwhelmed, they may inadvertently overlook the importance of cultural sensitivity. Additional, short-term project-based approach don't work well for indigenous community. They need long-term engagement and consistency to build trust.
That's crucial point. So what would you say are the best practices for achieving cultural safety in healthcare?
Okay, in my view, ongoing cultural competence training is essential. Every staff member should receive trainings, not just those on the front line. We also need to ensure that our policies allow for flexibility, for example, by offering telehealth options and allowing for flexible scheduling around cultural events.
I agree. We should also aim for co-governance model where community leaders have decision-making authority in how healthcare services are designed and delivered. Additionally, offering traditional healing options alongside Western medicine can make healthcare feel more inclusive and welcoming.
One of the most important practices is regular feedback from the community. We need to keep checking in with people to understand what's working and what is not. And when we receive feedback, we have to act on it to show the community that their voices are being heard.
All excellent points. Let's move on to the strategies we can implement in our workplace. What specific strategies do you recommend we prioritize?
We should start by consulting with elders and community organizations to co-develop a health outreach program. We should also offer mobile vaccination clinic that goes directly into communities. Many people may not be comfortable coming to mainstream clinics, so we need to bring services to them.
I agree. Another critical strategy is offering cultural tailored health education session, explaining communicable diseases and vaccines in a way that align with their values and beliefs. Storytelling could be an effective way to convey health messages.
Are any strategies more critical than others?
Yeah, I think engaging community leader early on is the most crucial. Without their support, it will be difficult to gain the trust of the broader community.
I would say that providing cultural competent care is equally important. If people don't feel comfortable accessing services, even the best outreach program won't be effective.
That makes sense. What sources of information do you find most valuable for promoting cultural safety?
Local knowledge from elders and community groups is invaluable. Additionally, ingenious health networks and government guidelines can provide useful frameworks.
We should also refer to community health surveys and report from local Aboriginal health services to understand the community's specific needs.
How will we know if our cultural safety strategies are working?
We can use surveys and community consultations that measure satisfaction and gather feedback. If the community feel comfortable accessing services and if vaccination rate increases, we will know we are on the right track.
Tracking health outcomes such as reduction in flu and COVID-19 cases will also be an important indicator of success.
How can we best involve ATSI people in this process?
Okay, so we need to consult elders and community leaders at every step and ensure that they have a real say in decision making. Creating a community advisory group could also provide ongoing input and oversight.
Who else should we consult locally?
We should involve local Aboriginal health services, schools, and youth centers to reach different parts of the community.
So, moving to the effective communication practices, what are the most effective communication practices when engaging with ATSI people?
Face-to-face communication works best as it allows us to build trust. We should use plain language and avoid medical jargon, and of course, listening actively and being patient will go a long way.
Thank you everyone for your valuable time and this valuable discussion. Let's finalize our action plan and schedule first consultation with the Daru community. Together we can ensure that our health services are not only effective but also culturally safe. Thank
Thank you.